Okay. All right. Welcome back to the KCCMH Connection, where we connect you to the people and stories behind healthcare in our community. Today's episode is a special one because we're joined by two of the providers helping shape what rural healthcare looks like right here in Kit Carson County. Now, before we jump in, I want to take a second and give you a little context because this is important to our community to understand. The partnership with TNT Med Staffing isn't about replacing our providers or filling a gap because we couldn't staff the ER. Our physicians have been covering emergency care here 24/7 for decades and doing it well. What TNT has allowed us to do is evolve. By sharing that around-the-clock coverage, our local providers are able to have a better work-life balance and spend more time delivering deeper, more consistent care in family practice, while still remaining closely involved in patient care. TNT providers work under the direction of our Chief of Staff, Dr. Pimentel, and collaborate closely with our team, especially on major traumas and complex cases. So this is really about strengthening care, not replacing it. And that's what makes this conversation so interesting, because TNT Med Staffing was founded with a simple but powerful idea, that rural communities deserve the same high-level, compassionate care you'd find in any major city. What started as a small group of providers has grown into a collaborative team that's now playing a major role in both emergency and inpatient care here in Burlington. Joining us today are Nate Cameron, PA, one of TNT's founding partners with a background in emergency medicine, paramedicine, and military service, and Chris Moore, nurse practitioner, whose experience spans critical care, emergency medicine, and even flight nursing. So, welcome to the show, guys. How are you guys doing today?
Thank you for having us. We're doing good, or I'm doing good.
Thrilled to be here.
Yeah, enjoying that wet stuff in the air that's so rare.
Right? We need it for sure.
Yes. So I want to start with the big picture. What made you guys look at your careers and say, there's something more we can do in rural healthcare?
So I spent the better part of a decade working in the urban sector, mostly in near Littleton in the Denver metro area. And as a friend reached out, he said that they need a lot of help out in the rural sector. And I kind of knew that in the back of my mind, but didn't really look at it very much. And that's kind of what sparked me, was a friend reaching out who was one of our original partners years ago. And he has since moved on to do ICU medicine in the Springs. But he's the one that kind of pulled the trigger for me a little bit. He showed me what it was all about. He brought me on as a partner and kind of taught me how to do rural because it wasn't something that I was used to. And when I say that I wasn't used to it, it's because we are really limited in resources out there. So you have to kind of become creative on how you're going to approach each and every patient.
How about you, Chris?
So my journey to Kit Carson, I was actually working with Dr. Brookins and Dr. Fabian at Rocky Mountain Kidney Care, and it was a fork in the road of my career that I never planned on. Our other partner, Turner, actually called our kidney office when I was working there for a consult, and we connected on the phone. I gave her the consult, and she said, "Hey, have you ever thought about doing rural medicine? It seems like you would be a good fit." And I was like, "No, I have absolutely never thought about driving 2.5 hours from Denver. But tell me more about this. You seem to be really happy with your job and excited about what you're doing out there." And I came out a month later, visited with Nate, and ended up leaving my job at Rocky Mountain Kidney Care 5 months later, and the rest is history.
Okay, awesome. So you both hold strong backgrounds in high-paced urban medicine. What is it about Burlington that you like, the change that you appreciate? Or maybe you don't?
We absolutely do. Chris and I talk about this often. Sometimes when you work in high-paced emergency medicine or even in nephrology, he was getting his butt kicked in the urban sector time and time again. You get so busy that it starts taking away from what we got into the medicine for, which is patient care and having a connection with your patients. You just get inundated because you're so busy that you don't really get to spend time with your patients. You don't really feel like you're making a difference. Whereas in Burlington, we have the opportunity to spend a little bit more time with our patients, have really good discussions with our patients, feel more connected. And then when we go home, we actually feel like we accomplished something. We feel fulfilled. We feel like it's we're back in love with the medicine that we fell in love with to begin with. Can I say that, Chris? Does that seem
Yeah.
right to you?
No, 100%. And, we talk a lot about, what we don't have in the rural setting, but truthfully, the allocation of resources in medicine follow volume. And so when you have less volume, it makes sense to have like fewer resources. But the other part of that is when you have less volume and you have a baseline of providers, those providers have an opportunity to spend more time with the patients. And, I think everybody that works at TNT really enjoys the challenge of working in that environment where maybe the path isn't laid out for you, or that consult isn't laid out directly for you or super easy. And so it becomes a challenge to deliver the standard of care that you're used to delivering in the city in this environment. And it's one that we all enjoy. And the problem solving aspect of rural medicine is so much fun because when it's done well, it is game changing for the patients. And, I think that in your lead in, you talked about us not replacing what Dr. Perez and Dr. Pimentel and the NP partners at Park Health were doing here. We're giving them space to do their best in the clinic. And then also by onboarding us, it gives us more time to deliver really great care in a more challenging environment.
Mm-hmm.
That's right.
Yeah. So in terms of resources, is there anything that really surprised you about either patient care or the resources that we have or don't have out here?
Yeah, I'll take that one. So we just onboarded a doc this month that is going to serve as the inpatient medical director. Her name's Dr. Boyer. And, one of the selling points about bringing somebody out to Kit Carson is you get to tell them what a highly functional facility, even though it's small, it's highly functional. The nursing staff is solid. Imaging, radiology are all really, really super solid departments. EVS is amazing. Facilities is amazing. And so you walk them through our facility, especially the 2008 edition, and it is a somewhat thoughtfully laid out facility, but most importantly, it's really well maintained. Nate and I have both worked in other hospitals that aren't maintained to the standard that KCCMH is maintained. And as I was talking about it, we were walking through, and John and Ted were working on a project in one of the ER rooms, doing some basic maintenance. And at another hospital, it probably wouldn't have been done as quickly or aggressively as what they were doing. And so, yeah, this place is super functional. And the other part that's great about working in a smaller environment is when you see an opportunity to enhance patient care, it is super hard in big systems to align all the stakeholders to make that change. It's a little easier in a smaller environment to get folks aligned to make a change that you see as a positive.
Yeah.
And it's one of the things that I absolutely love the most about working here is, we see a problem, we go to, our exceptional administrative team, Lana and Brian, Kathy, and say, hey guys, this is what we're seeing. And then, the tremendous managers of the individual departments are generally on board and, things evolve relatively quickly here. And it supports that foundation of quality that we're trying to deliver to the community.
Not to mention the board has been very exceptionally receptive to
Oh my gosh, yeah.
requests and desires and helping us maintain our mission and vision. They've been awesome at it. Back to the resources part, I think one of the things that I took for granted and didn't realize until I got out there and actually started doing the medicine was how many patients needed to be transferred. Chris and I have been working tirelessly to try and figure out a way to keep more patients in Burlington or in the county, because we understand what a struggle that can be for families when they get separated from one another or have to deal with those dynamics of being transferred and having to get family to them and then them back to their home after they get discharged if they were admitted in another hospital. So we've been working a lot on how can we keep more patients at the hospital and admitted to the hospital by developing appropriate policies and protocols for those.
Yeah, I know that that's going to be a game changer for our community is when I know that by our numbers that we are able to keep more patients than we used to, but when that program keeps evolving, that's going to be a game changer because, as you know, our population out here is aging, and that's one of our concerns is transportation both to and from Denver for them.
Absolutely. Absolutely.
So, Nate, going from the Air Force medic to paramedic to PA, how does that shape how you approach patients today?
That's a really good question. So I think that my very first question with any and every patient when I walk into a room is sick or not sick. That's the very first question that enters my brain. And when I say sick versus not sick, it's more like, are they going to die right now? Or do I have time to kind of figure things out? Do I need to start a chopper right this moment? Or do I have time to work them up and kind of figure things out? And so that's the very first thing. That was taught to me in my military career, and then it transferred into being a paramedic. Chris had the same thing when he was a flight medic. As soon as you see a patient, are they sick, not sick, and then go from there. And then a very stepwise approach. I think both of us follow something very similar. And almost always for me, it's head to toe. Like I literally think about walking through their body systems head to toe. Now, if it's a small, a laceration on their toe, I'll look quickly to make sure that nothing else is going on, and then I'll focus in on the toe. But almost always, it's sick or not sick, head to toe assessment, done.
Like rapid trauma assessment, good old fashioned EMS.
Yeah, and you can even do that with medical patients. Somebody comes in with nausea or chest pain or whatever, you still walk in sick or not sick, because there's those patients that have chest pain that are actually having a heart attack that could be absolutely life-threatening, and they may be sick, like really sick, and I need to start a chopper now and then get back to the medicine. So I still do it despite it not being a trauma patient. I do the same thing.
Excellent. And so, Chris, kind of the same question that you've literally cared for patients in the air as a flight nurse. How does that experience change how you think in critical situations now?
Well, so one thing, I worked on an ambulance and a helicopter, and the one thing that mirrors rural medicine is, just like Nate said, the triage. What resources is this patient going to require in the immediate stabilization phase, and then what are they going to long term require to manage their condition? And so, yeah, that experience of sorting that out and running that script through your head of what this patient might need is super helpful. And I had the benefit on the other side of being both an ER and an ICU nurse and kind of seeing the full continuum of care, and that's experience that I fall back on to every patient.
That's awesome. So, and I'm curious, when you guys are working together, do your backgrounds ever lead you to see the same situation differently?
Go ahead.
I don't think so.
I don't think so either. I think that Chris and I are really usually on the same page. Every once in a while, we have a different thought, but that's more of from an administrative standpoint when it comes to owning TNT. We might differ a little bit, but when it comes to patient care and our workups and stuff, we're usually right on, and we bounce stuff off of one another as well as our team. Chris and I are really fortunate. We have amazing contractors that work at Kit Carson underneath TNT, and we couldn't do this job without them. They're amazing. And I think all of them work about the same way. We're all trained in ACLS. We're all trained in ATLS. We all come from similar backgrounds to some degree. And I think we have a group text, and if somebody is caught up on something, they send a message out on the group text and say, hey guys, what do you think about this? I'm seeing this type of patient. We are very considerate when it comes to HIPAA, of course, not, releasing patient data, but I may say, I have a 6-year-old with some weird EKG changes. What do you guys think? Mm-hmm. And we're able to bounce those ideas off of one another and get some collaborative assistance on managing that patient.
Oh, that's awesome. Probably especially because, again, you're all aware of what we have and what we don't have here at KCCMH. So understanding the tools at your fingertips to treat that patient probably very helpful.
Yeah. And then, pretty much all of us have some additional secondary background. Like Moody worked in pulmonology before she was a hospitalist, and then Bree worked as a hospitalist. Dane was an ICU PA for a number of years, and I worked in nephrology. So when those subspecialties pop up and you've got questions in those areas, you know, yes, we can always call the city and talk to a specialist in that specialty, but sometimes you don't need that, and you just need, hey, what was best practice when you were working in there? And it just a quick curbside, and we have that, and that is invaluable in our group.
Agreed.
I bet. So now that you guys are expanding into patient care or to inpatient care here, what does that mean for patients locally? Or can you explain what inpatient care is as opposed to emergency department?
Sure. The inpatient care is, once the patient is admitted to the hospital. So you come to the ER, you've seen Nate. Nate looks at you and goes, I think this is something we can manage here. And then he'll pick up the phone and call myself or whoever is covering the hospital that day. And we go, yeah, we agree with you. This is like totally appropriate for us. Let's do it. Get them admitted. And, there are 3 types of patients admitted to our hospital: observation patients, acute care patients, and then swing bed patients. With the OBS patients, it's more of an insurance and billing thing, but there is some differentiation in, I guess, how sick you are. There's some thresholds and milestones for that. It's something that we think about, but we don't make a decision or change your care much based on the status that you are, whether you're observation or acute care. And then swing bed patients are patients that have come back after their acute hospitalization for rehab services. And, we're still involved in their medical care, probably not as intensively as we are for the observation and acute care patients. But those patients are, within our purview while they're here at the hospital.
What was the moment where you thought, this is exactly why we came here?
We have that a lot. Chris and I talk about that. I would say maybe once every 2 weeks we would say this is exactly why we needed to do this, or exactly why we set up X, Y, and Z, or this is why we took on the inpatient service. Like that guy, had he gone to Denver, it would have been a nightmare for him and his family to get him not only stabilized up there, but then back here. We say that all the time to one another. So I can't remember like the very first one, but it's a continual that what we are doing is right for the community, I guess is the best way to say it.
For sure.
Yeah. I mean, there's always aspects of medicine that are a little bit of a grind, insurance, charting, administrative stuff. It's a grind. It's a part of the job that nobody says, gosh, I love that. But
Yeah, that was kind of my follow-up question, is that but people think you're an ER provider, it must be like so much adrenaline, but I'm sure there's parts of the job that people don't see.
That's
Absolutely
true.
Yeah.
We spend a lot of time in the background doing charting and behind the scenes stuff that patients don't get to see or need to see or even want to see. Yeah,
but those moments that fill your cup come often at Kit Carson, and it's wonderful to be there.
Yeah,
that's awesome. So let's talk about a little bit growth, team, and future. So TNT is growing pretty quickly. What do you look for in providers joining your team?
I'll jump on this, Chris. Probably the first thing that Chris and I look at is, are they going to be a team player? Are they going to be somebody that gets along not only with our administration, but the hospital's administration? And more importantly, are they going to be able to get along with the staff? We don't want somebody who's going to be, I guess for lack of a better term, hard-headed and not willing to play ball with the other team. So whether that's a tech or a nurse or another provider, whether that's the lab or radiology or even the EVS staff, we don't want anybody who's going to be grumpy, rude, callous, any of those things. So that's number one. Number two is we look for somebody who's going to be a competent provider, so we know that our patients are getting the best care that they can. And I would say, thirdly, that kind of combines those two. We want somebody who, while they're at the bedside, are empathetic. They're caring. They actually, instead of just saying, I want to help people, and they're actually doing it for the paycheck, they want to help people because that's what their love is, and they actually do that. And so I would say those are our top three. Chris, do you want to add to that? Or
I mean, you kind of hit the nail on the head, and the uniqueness of this job creates a recruiting challenge.
yes.
You got to have a lot of balance, and truly, you can be an exceptionally amazing, talented provider, but if you make it about you and not about the patient and the team that is caring for the patient, you're going to fail out here. And we're not, if you sneak past our hiring process, you won't last. And and then on the other side of that is you really do have to have the skills to be out here, because we are super well supported by the physicians, and Dr. Perez and Pimentel, are amazing at supporting us, but the expectation is that you be able to do the job. You can't call them for everything, or
Right.
depend on them for to touch every patient with you. That's not what this job is about. And so that balance is a little bit tricky, and we do have probably a little higher attrition rate. Well, I know we have a higher attrition rate than a lot of jobs, and that's okay. That's we only want to have the right people here, and been super well supported by administration and making sure that we have the resources to do that.
Yeah.
Yeah.
And I know, rural medicine isn't for everybody, not just in emergency department, but, nursing and the family clinic. So I'm glad that you guys are willing to maybe let somebody go that isn't a good fit, because we do get a lot of comments about the TNT group through the emergency department, and they are so positive. People believe that you guys care, you listen, and that they feel like they are getting very high quality care from your team.
That's wonderful to hear. That's something in medicine that doesn't happen very often, is that you hear, we hear a lot of the bad stuff sometimes, but we don't often hear the good things. And like you mentioned, and Chris mentioned, if we have somebody who turns out to be not a great fit, we have to let them go. And it's hard sometimes, because we really like them from a personality standpoint. Like, we would love to hang out with them and play golf with them or something like that. But that doesn't necessarily mean that they're a great fit for Kit Carson.
Yeah, like you were talking before, though, a lot of the stuff that happens out here in every department is problem solving, and not everybody thinks that's an enjoyable challenge.
Right.
Yeah, and the most important thing to Nate and I, and really the entire care team, is that when folks enter the front door at KCCMH, we want them to know that they're going to be well taken care of, and have confidence in that, regardless of who is sitting in that box in the ER.
Right.
For sure. So where do you guys see TNT and rural medicine heading in the next 5 to 10 years?
Well, that's a big one. Chris and I, we've been brainstorming on this quite a bit, on whether we solely stick with Kit Carson and just making that our home and not expanding, versus going to other places and seeing what we can offer to other sites and other facilities, seeing that we've been pretty successful at Kit Carson. So that's still kind of up in the air. We have no plans on going anywhere from Kit Carson, that's for sure. We really enjoy it there. That's like our home base. That's where everything started, and we love it there. And so we don't see ourselves leaving Kit Carson County Memorial Hospital anytime soon. Whether we expand to other facilities has yet to be seen. We're kind of bouncing it off our contractors a little bit. One of our previous owners and founders, we're talking to her a little bit. And so we're not sure as far as, are we going to expand to other facilities at this point? Chris?
Yeah, so the amazing thing about Kit Carson is the bar is set so high from a facility support standpoint for contractors like us. The board, the physicians, the nursing staff, and the administration are all so exceptional here. It's kind of hard to think about growth to a place where you don't know if you're going to have those supports. And is the facility going to be as functional as the facility in Kit Carson? And the answer is probably no, it's not going to be. And so it's going to be a lot harder, whatever you take on there. But the flip side of that is if we are a little bit bigger, it creates a little bit more of a stable practice that's easier to recruit into. And so the question is smart growth, and will those smart growth opportunities present themselves? Who knows? I think Nate and I wouldn't say no to the right situation, but we're not looking to expand for expansion's sake by any stretch of the imagination. And then kind of back to the higher level of your question of like, where do we see rural healthcare going? Yeah, there is a lot of unknowns. I listened to Brian's podcast from last month, and, I share the same kind of cyclical nature of rural healthcare in terms of payer support, and that does impact us. And then we're also at a technology precipice here where things like telehealth are definitely involved, changing what we're doing. We have developed an amazing relationship with Common Spirit and their teleneuro program. Nate and I had a conference call with them yesterday, and we are so impressed with the care that we're able to deliver with them. And so how do you integrate more of that? And then, I do think artificial intelligence is going to change a lot of things in medicine, and rural healthcare is going to be affected just like that.
Yeah. Those are just definitely very high level things that are really honestly affecting all of society.
Yeah.
And so, yeah, it's very exciting to see which way those things will go. So if someone's on the fence about practicing rural medicine, what would you tell them?
So the only way that somebody is going to find out how they would do is to jump into the pool. Right? They're going to find out very quickly if they can swim or not. We've had people who have been in emergency medicine come out and try to work with us. They've been in emergency medicine for years and years, even sometimes decades. And then they get into the rural sector and they're like, absolutely not. I can't do this. I don't like it. They're the people that like to have all those resources at their facility. Usually it's an urban sector area. And then they get out to where we are and they don't like to play that chess game. They don't like to do the problem solving that Chris and I so enjoy. And so if somebody's on the fence about whether or not they want to try to be in the rural emergency medicine or even inpatient setting, the only way that they're going to learn that is if they jump.
Just give it a try. Yeah. So another comment that I hear frequently about the partnership or with TNT in the hospital is how willing you guys are to teach not only our nursing staff, but I've heard it from the EMS crews that come in that, they can stay and watch you guys work and learn. So I just want to say thank you for that too, is that people don't think of little hospitals as a place of learning, but you guys are helping that happen here.
Oh my gosh. That's too bad, because little hospitals are amazing opportunities for learning, because you'll
100%.
See and do things here that happen in big cities, but it's a much more intimate setting, so you get to be involved in that. And, the patients in Kit Carson, on average, I would say that average ER patient is probably sicker than the average ER patient than in a big city. And they present with all the same problems. And right. So it's not like there are only sick people in big cities. No. People get sick out here too, and you got to think through that. And we've had a number of PA students rotate through here, and a lot of them have said, "Oh yeah, this was easily my favorite clinical rotation. I learned more here than I did at X, Y, and Z."
Yeah,
that's awesome.
I agree.
So if you can leave the community with one thing, one message about their healthcare or what TNT is trying to build, what would it be?
We care. A lot of, they say that, I don't remember what the quote is exactly, but it's something to the effect of, Just because you're rural healthcare doesn't mean you don't deserve urban healthcare medicine, something to that effect. And Chris and I wholeheartedly believe that. We care. Reason that we're out there is because the community deserves it, 100%. Mm-hmm. They deserve to have big level care at a little level facility. And we enjoy what we're doing, and we enjoy all of our patients.
Yeah, I mean, this is a two-way street in terms of gratitude. We are so incredibly grateful for the support of the community, the board, and the administration. I'm going to just probably share a little bit about, my situation. After I left the nephrology clinic, my father-in-law unexpectedly passed away last February. If I would have been still working at the nephrology clinic, I would have definitely gotten fired because I needed 2 months of family time, and I wouldn't have had that space there. With this job, because we work in 24-hour shifts and cycles, sometimes stacked together, there's a lot more flexibility in this job than any other job that I've previously had. And the community is incredibly supportive of us, and this job has been a game changer for my family and allowed me to lean into my family life and have much better work-life balance than I would have otherwise been able to have. And the converse of that is, I very, very committed to the community and ensuring that I'm delivering back on what the objectives are of the organization and TNT.
Mm-hmm.
Yeah, that's great. And I love that, your message is simple. We care, because here at Kit Carson County Memorial, we care too. And I think that's why our partnership works so well.
Amen.
Yeah.
I agree with you wholeheartedly.
Yeah. I mean, Nate and I have said this before, easily the best job we've ever had.
Mm-hmm. That's true.
Awesome. That's so cool. So is there anything else you guys want to leave our community with, or shout out your company or any of your players before you go?
Yeah, I'm just go ahead,
Chris.
I'm just grateful for everybody. I mean, we have this amazing team, and it's a true joy. I mean, is every day perfect? No, absolutely not. It's healthcare. There's messes all the time, and there are interpersonal interactions where sometimes you say, gee, I wish I could take that back and do that a little differently. But overall, this is like a family. And the KCCMH family has embraced us, and I hope that we're embracing them back. It feels like we are, and it's a joy to be a part of. And yeah,
I think my message to everybody, whether it be all the staff at Kit Carson or the community at large, I would just say thank you. We're grateful.
Yeah. So grateful.
We're humbled to have this opportunity to take care of the patients.
That's awesome. I know I said it before, but we have heard many great things about the service that you provide for us. And so I just look forward to continuing to grow that relationship with TNT, and growing our own is very important to us. So however, that relationship evolves, or our staff evolves through learning through you guys, we're just very excited about it.
Yeah. Thank you very much.
Yeah.
Well, thank you so much for having us too. I mean, it's a thrill to be able to connect with the community in this way, and your podcast is just tremendous. So thank you.
Oh, thank you.
Done.
Thank you. And again, there's so much great stuff that happens here at KCCMH, kind of behind the scenes, and maybe you don't experience it unless you're a patient and you go through that. I've had my own kids in the ER to see you guys, and it feels, like the care is good, but also I can tell that you care about your patients too. And that's just, from a mom with a kid in an ER, that there's just nothing that can replace that. My kid's in good hand right now.
Right.
So thank you.
Thank you.
But anyway, you guys, thank you again for joining us on the KCCMH Connection, and we look forward to our next podcast, and take care.
Thank you.
Bye. Thanks.